The United States has many old problems that need to be addressed. The fact that marijuana is a Schedule 1 drug still to this day is quite embarrassing. Our country is moving forward, and I think that eventually we will pass a law on the federal level that will recognize state medical marijuana laws by the government. There are many medical benefits and issues that can be resolved if the government would legalize this herbal medicine. Firstly, I would like to go over why and how the United States is ready for marijuana on a federal level. The American people are ready for the legalization of marijuana. In an article called Why 2021 Should Prove the Year of Federal Cannabis Legalization, we learned from Lori Kibbe statistics and polling regarding legalization and decriminalization of marijuana. Lori Kibbe is a co-founder and chief financial officer of King's Garden, California's preeminent cannabis cultivation, processing, distribution, and manufacturing company. More than half of the states in the union have already decriminalized medical marijuana. Some of those states have even legalized it for recreational use for adults. From the article, we learn already 35 states and Washington, D.C. regulate the production, sale, and use of marijuana for medical purposes. 15 of those states also allow adult recreational use according to the National Conference on State Legislatures. Also, a Gallup poll this year showed that 68% of the United States adults support federal legalization. Strengthening public support is reflected in soaring cannabis sales. Polling is strong across the United States people regarding marijuana, but the money that the states are pulling in speak for themselves. Many state economies are flourishing with the help of medical and recreational marijuana. States like California, Colorado, and Washington were some of the pioneers in the marijuana decriminalization and are doing very well economically with the help of medical marijuana and recreational. The United States marijuana industry is now valued at more than $18 billion, supporting the equivalent of at least 300,000 full-time jobs, according to the 2020 Marijuana Business Factbook. The legal market in California, the nation's largest, reached $4.4 billion in sales, up from $2.8 billion a year earlier. Sales in Colorado topped $2 billion last year, up from $1.7 billion in 2019, while Washington State exceeded $1.4 billion, up from $1.1 billion. There are many studies going on regarding the health benefits of marijuana. Up until recently, many of these studies have not been legal to conduct in the United States. In an article published by WebMD, Medical Marijuana FAQ, many different questions are answered regarding the health benefits of cannabis. Currently, many people use medical marijuana to treat medical conditions like Alzheimer's disease, appetite loss, cancer, epilepsy, glaucoma, nausea, pain, and seizures. Some of these medical conditions have yet to be proven and require more research before they can be vouched for. Marcel Bon Miller, who has a PhD and is a substance abuse specialist at the University of Pennsylvania, says, the greatest amount of evidence for therapeutic effects of cannabis relate to the ability to reduce chronic pain, nausea, and vomiting due to chemotherapy, and spasticity, tight or stiff muscles from MS. Marijuana has already had great impacts to communities that have decriminalized it, and not just financially. Marijuana is helping communities combat against the opiate crisis that we have currently in America. One article from Healthline.com called Study Finds Lower Opioid Deaths in Counties Where Cannabis is Legal has data that shows lower opioid-related deaths in counties with medical marijuana. Opioids are a possibly dangerous drug used to treat pain. They are very addicting, and if used improperly, can cause death. A study that was conducted by BMJ has data that shows that counties with medical cannabis dispensaries have a lower death rate caused by opiates. From the article, the study's analysis showed that increasing the number of dispensaries in a county from 1 to 2 was linked to a 17% drop in deaths due to opioids. Chelsea Shover, who has a PhD as an associate director in the Division of General Internal Medicine and Health Services Research at UCLA School of Medicine, says, one of the strengths of the study is that researchers examine the data at the more fine-grained county level. With all of the previous information that I provided, I think we can all agree that the United States is ready to move on from an age-old policy that doesn't really fit with today's society. Not only have I gone over the medical reasons, but also it could help with opiate addiction and even possible alcohol addiction. It is time to act, America. It is time to move forward and come together as a people to make sure we allow this medication to be used properly and effectively by the people.